My name is Kevin McKinney. I'm a glaucoma specialist and ophthalmologist here with EyeHealth Northwest. I went to medical school, Baylor College of Medicine in Texas, and then went on to Iowa, the University of Iowa, to study ophthalmology and to do a glaucoma fellowship. My interest in ophthalmology actually began in medical school. I had attended lectures of a surgeon who worked in Malawi, Africa, and dealt with people with severe blinding eye conditions. That sort of instilled a passion in me to help people who have eye conditions that impair vision, both here in the U.S. and around the world. I went on to study ophthalmology at the University of Iowa and did a glaucoma fellowship there as well. Glaucoma grabbed my interest because it's a silent thief of sight. It causes loss of vision early in the disease, and patients don't have symptoms until quite advanced damage has occurred. Because of that, it's really critical for skilled physicians to do eye examinations and catch glaucoma at an early stage. I chose to become an eye doctor because of the beauty of the eye as a part of the body. It's just an amazing organ. The physiology of sight is really quite amazing, and the effect of disease on that system has such an impact on people's lives. The ability to treat eye conditions to prevent visual loss or to correct it once it has occurred is just an incredibly rewarding experience. My practice is primarily focused on the treatment of glaucoma. I do see general patients and do general ophthalmology, but probably 3/4 of my patients have glaucoma. Treating glaucoma to prevent visual loss is the focus. The things I'm most passionate about in ophthalmology really are a couple. Primarily, it's the preservation of vision. Individuals, particularly with glaucoma, who are losing vision and could become blind during their lifetime, the ability to intervene with medical therapy, laser therapy, or surgery, and try to slow that process or stop it so they retain functional vision for their life, that's really what keeps me interested. Another aspect of interest for me is international ophthalmology. I have a degree in public health and have worked in Africa, Saudi Arabia, China, and Latin America doing eye surgery, but more importantly trying to teach individuals, physicians there in their local countries, how to care for eye problems like glaucoma and cataract. We have our particular eye problems here in the U.S., and blindness for anyone is devastating, but the magnitude of vision loss in the third world is just astounding. What sets my practice apart is the personalized attention that we seek to give every patient who comes to see us. Not just that they have a condition, a problem called glaucoma that needs treatment, but that they are a complete person with their own emotional, mental, spiritual issues. We want to treat their condition within the context of who they are as a person. My goal for the future in ophthalmology is to stay abreast of current developments in the diagnosis and treatment of eye conditions, particularly for me of glaucoma. There are a number of medications on the market which have different efficacies, different side effects. Understanding how those interact with your general medications is critical. Understanding surgical techniques as they develop are very important. We currently use a surgical technique that was actually developed 50 years ago and has had minor modifications that have increased the success rate over the past 10 to 15 years. There also are a number of surgeries that are being done in America that have not been proven with good standardized research. Those procedures we'd like to wait to perform until research shows that they clearly are beneficial without increased risk over our standard surgery.